Hello and welcome to Reproductive Rebel. I am your hostess, Adrienne Irizarry. As an Eastern medicine practitioner that uses holistic approaches to women's care, I tackle the elephant in the room, our collective frustration with the allopathic healthcare system. In this podcast, I give you a new way to look at your body, understand what it is telling you, and care for your reproductive health. Welcome to this journey. I'm so glad you're here. Statements made in this program are for educational purposes only and not intended as a substitution for medical consultation or advice. We do not claim to diagnose, treat, or cure any diseases. This podcast is inclusive and welcomes all gender identities. The focus of the program is on biological function, and we will use the term women throughout, but it is referencing physiological and social challenges for biology, not identity. Come as you are. I am happy you're here and welcome all performances of identity. I hope you find something helpful in this show. Welcome back to another episode of the Reproductive Rebel podcast. I am so excited to be joined by Dr. Ryan Bailey today and talk about this pelvic floor thing, because we do not realize just how important our pelvic health is. So I wanted to bring on Dr. Ryan Bailey to talk about why it's important, and then specifically look at how it pertains to exercise and things to be mindful of there. So welcome to the program, Dr. Bailey.
Oh, thank you so much for having me, Adrienne. I'm excited to be here.
Well, and I'm excited to talk about this topic because we just totally take for granted our pelvic health and how important it is until things aren't working right. And then we're in crisis mode because it's like, oh, I did not know I could have this level of dysfunction. I didn't know that this could fall apart this way. And now what? Not to mention the fact that as a pelvic PT, I find that every person should use one. Yes. And yet nobody knows they exist. It's so frustrating.
Absolutely. Yep.
And I refer a lot to pelvic PTs because there is such a synergistic relationship between your pelvic health and all of the functionality of your organs, your muscles, your fascia, and what I do with peri-steam hydrotherapy. So it's such a beautiful relationship. And I'll tell people, steam, then go see your doctor, because then they'll get more benefit out of the exercises and all the beautiful things that they do with you. So let's talk about why pelvic health is important.
Absolutely. I mean, when I think about pelvic health and it's important, I think about the 5 S's or the 5 roles of the pelvic floor. And it spans so many different things. So we think about the support that our pelvic floor provides for not only our pelvic organs, our bladder, our reproductive organs, and our bowels, but everything above that. So it's really important for support of our organs. It's important for the control of our pelvic organs. So the sphincteral control of our bladder and our urethra and our bowels and our anus. So we want to make sure that it will keep things in and let things out when it is meant to come out. It's really important for our stability. So our joint health of our pelvis and our spine and our hips, very important for stability so that our trunk and our pelvis can be nice and stable so that our limbs can move for us. It also has a sexual function. So we want to have really healthy pelvic floor tissue so that we can have arousal and orgasm and no pain. And then lastly, the fifth S out of all of these S's is sump pump. So it's really important for our bodies to be able to flush the fluids from our legs up through our pelvis and into our circulation so that it can be processed and then we can excrete it out. So our pelvic floor, those muscles are part of that pump, and is super important for that. So those are really the things that I think about when I think about the importance of our pelvic health. It's kind of this huge broad spectrum from muscular health to joint health to organ health, all within this small portion of our body. And my husband said it best when I was talking to him about the pelvic floor, because I do that. And he's like, it sounds like it's the keystone of our body. And I was like, it is. It's our keystone. It is. And he's in the building profession. That's why he thinks keystone. But, it is, because everything below our pelvic floor and our pelvis impacts it, and everything above it impacts it, and then vice versa. So the importance of our pelvic health is the importance of our entire health.
Yeah.
in my perspective, because it really impacts everything that we do, from our breathing to how we move.
Yeah. And I totally agree with you. Even from an Eastern medicine perspective, it is a keystone as well, because
The emotions.
That is a big one. Yes, we do hold a lot of emotions. And I'm sure even in your work, you see emotional hurdles.
Absolutely.
That are showing up physiologically in people's
Yep.
bodies. And I know, just from the lens that I work in, I see that all the time.
Yes.
And one of the beautiful parts about when I work with people in terms of pelvic steaming is it helps to kind of unlock all of that, not to mention the circulatory support and, just increasing warmth in that area really helps everything to work better. But, the body's broken down into 3 zones. In Chinese medicine, the upper jiao, the middle jiao, and the lower jiao. And your lower jiao encompasses all of that. It's like the belly button down. So when you were talking about the sump pump effect,
Yes.
the people get edema in their legs and in their
Mhm.
feet. And we normalize these like sock creases around our
Right.
calves and stuff, not even realizing that actually is showing that, our pelvic health and our circulatory system just really need a lot more
Yeah,
support.
absolutely. Yeah. Swelling during pregnancy, varicosities, hemorrhoids. I mean, those are things that it's like, okay, what is the health in our pelvis doing? Unfortunately, in our society, in our culture, and mostly the Western culture, this is normalized. It's normalized to have pelvic health issues. It's normalized to pee your pants. It's normalized to have pain. These things are normalized. It's normalized to feel pressure. Oh, you're a mom now, if that is what your journey is, and just deal with it. So why do we have to just deal with these things? We don't, and unfortunately, because that message is portrayed, that, oh, you have to run to the bathroom 20 times during the day, or you're getting up in the middle of the night, or what have you. People think that they don't have the option to fix these things or to have a better life around it. And especially with a sexual function, that is not, it's taboo talk.
Totally. It absolutely is. I agree with you.
Still have patients come in and say, oh, this is TMI. And I'm like, honey, nothing is TMI in my office.
Yes. I say that
need
too.
to know these things. I need to know these things.
Yeah.
And don't be embarrassed about it. This is what I'm here for.
Right. This helps me help you.
Exactly. And so, these messages are really unfortunate. And myself and all of my colleagues are trying to educate everyone out there, because everyone has a pelvic floor. Even though I specifically work with women who are within the childbearing ages, that just because I do that doesn't mean that
Mhm.
that is the only people who should seek help. Everyone should, even unfortunately, some kiddos should. So it's, yeah, I mean, everyone, like you said, should have a pelvic PT
Yeah.
in their health team, and especially for women who are in that childbearing years should probably be seeing pelvic PTs like they see their dentist as a
Yeah.
as a yearly check-in to say, okay, how are things going? Because we will totally get into as to why
Yeah.
things can change.
Absolutely. And then you have any life transitions, whether
Absolutely.
it's birth, whether it's perimenopause into menopause, like
Hmm.
all of those transitions. Like I have a large number of clients that assume that because they're no longer in their bleeding years, that no dysfunction happens down there anymore. And it's like, oh no,
Oh no.
sister, we have entered a new zone of the things that could potentially
Yes.
happen there. And
Yeah.
and you hit it spot on when you were talking about the things that we normalize in our culture.
Yeah.
It is the whole reason I started this podcast, because it makes me insane the
Hmm.
number of things that our culture normalizes in women's health, from menstrual cramps and
Mm.
PMS and feeling wildly emotional. Like those are all quote unquote normal,
No.
and they're not. But peeing your pants is a big one. I can't tell you the number of people that just in conversation, they're like, haha, I laugh too hard. I gleek. And I'm like, you what? And they're like, I giggle and I leak. And I'm like, wow, that's a one. That's a new term for me. And two, that shouldn't be happening.
No. No.
Whether you've had
Yes.
babies or not,
Exactly.
it can happen.
Hmm. Yeah.
Particularly with age, it can
Yes.
start to happen. But if
Yep.
you've had a baby, like
Yeah.
one of the things that really makes me crazy about maternal health care in our country, and I say our country, I mean in the United States, um, but really in a lot of places, is the fact that pelvic PT is not part of your standard
Hmm.
of care after you have a baby. They like sign off on you at 6 weeks and they're like, oh yeah, you can go back to normal function and do
Hmm.
all the things.
Yeah.
Hello? We don't take puppies away from their moms
Right.
before 8 weeks. Why would we sign off on all of your normal daily activity? Oh, and by the way, you can go back to work and be
Yeah.
away from your little person. Like, it's
Yeah.
insanity to me.
Yeah. I mean, it's birth, regardless of the form of birth that you have, is like running a marathon. It is legit.
Yeah.
That's what evidence shows.
Yeah.
And we treat it, yeah, like you just stepped outside and didn't do anything. And versus someone who had an orthopedic surgery and they get all of this care.
Yeah. Weeks and weeks and months worth of PT.
Has
And
such a huge difference. And
yeah.
it's and I am a huge advocate of prevention and being proactive. And there are so many things that can be prevented from happening and or at least minimized by just taking the steps to see the correct person
Mm-hmm. Mm-hmm.
for the education and for the training in certain techniques. And this will save the person time, substantial amount of money,
Yeah.
and headache. And it will improve their quality of life by tenfold because they can then not have to worry about all of these things that could happen to their bodies. And yeah, and a lot of the times what happens is, like you said, we have these big events in our lives. We have puberty. Whoo! I mean, the things that we should learn as a teenager,
Oh my
really, and
gosh.
even it's younger now,
Yep.
the things that we should learn about our bodies, we don't. And then in our maternal years, and birth and postpartum and like what we should learn. These are huge hormonal events in our bodies, not only just physical, but, and menopause. And a lot of times what happens in our early years, they accumulate and they don't then show up
Yeah.
until our menopausal years.
Yes.
And it's like,
Yes.
why? Why did this happen? Okay, well, let's look back on your life and
Yeah.
look back at all of these events. And what happens is that layers and layers and layers, and then bam.
Yeah, exactly.
And we lose then these, a lot of estrogen, these hormonal supports that we have. I call estrogen our fluffing hormone because it's so important in our muscular function and our tissue function. And then it's like, oh, okay, well, everything that's been leading up to this, and just normal events in our lives, that we didn't know that we should do something about,
Mm-hmm.
then have accumulated so much that your body just can't handle it anymore. And now we have an issue. Whereas we could have minimized that or completely prevented it.
Yeah, absolutely. And I see that with my clients all the time too. And I'm trying to raise awareness about that perimenopausal menopausal transition, because I see the exact same thing. It's like all of the years of the way that you've lived your life and the way that you've spent your chi, all of a sudden you get to this hormonal transition and it's like, oh, hey, girlfriend, this is what we haven't been doing this whole time. And so, it forces us to really take a step back and look at, okay, so if I'm not going to continue to have this problem, how am I going to make some changes? And what is actually going on in my body right now that is causing these things to show up? And so it's critically important. And I love the whole, preventative approach to all of this, because that's the world that I live in too. Like so many things with pelvic health, with menstrual health, with that transition into menopause, all of those things can be minimized, prevented, altered. Your experience.
We have control.
We totally do. And our lifestyle in Western culture is just not female friendly. Like we're expected to work like we're in spring and summer energy all the time. We never have that balance between play and rest and working really hard. We're just expected to work really hard all the time. And when we're in that chronic stress state all the time for such a long period of time, it has fertility effects, it has hormonal effects on the body, it disrupts that HPO axis. Like there's so many things that it causes issues for in the body. And then we get to these big landmark transitions in our life and go, well, I don't understand why this isn't working. And it's like, well, because we're not caring for our body. We're just trying to push through everything all the time. We're highly caffeinated. We're pushing ourselves through to just get through the end of the day. We're not honoring our biorhythms. Our sleep quality stinks. Like there's so many things that just create all of this cumulative effect that you're talking about. And then it shows up and then bam, we're like, oh, this is completely disrupting my whole life. And this isn't working for me. So one of the things that I talk to my clients about a lot is exercise around this issue. And this is why I wanted to have you on, because I know this is an area that you are very well spoken in. And when I met you years ago, that it was one of the things that you talked about that always stuck out to me is lifting and your pelvic floor, how to exercise in an intelligent way. Because in the West, we have this, again, it goes with that same, you're supposed to go hard or go home kind of mentality. And we have no regard for our cyclical movement, which I talked about in a previous episode. But, specifically when it comes to weightlifting, like there are a lot of women who are afraid of it. Let's start there, because they're just afraid they're
Yeah.
going to bulk and look manly. And honestly, when you are an estrogen being, it takes a lot of work, very
Yeah.
mindful dietary work, and
Mm.
oftentimes supplements in order to look that way.
Mhm.
You don't just look manly. But what kinds of concerns are there about lifting in respect to the pelvic floor?
Absolutely. Yeah. So because the pelvic floor is kind of the convergence of so many different um, functionalities for our body, it takes on lots of different roles in exercise. But one of the biggest roles in exercise is how it is managing pressures within our trunk and within our body. And so that is what we have to think about when we are especially lifting, especially lifting, but any form of exercise, how we are managing the pressures within our body when we are loading it. And if we are unable to manage those pressures, what's going to happen is those pressures are going to leak out of us
Literally.
in places that we may not want them to leak out of us. And so what may occur is there may be pressure down into our pelvic floor. This could cause just a sensation of pressure. It may cause the sensation of like a falling out sensation. It may actually cause leakage of fluid. You may fart, so it could be a leakage of substance as well, not just the pressure feeling. It could also be a pressure outward into the abdominals as well. And that is related to your pelvic floor. So, so for those who have any worry about what's going on in the abdominals, so say you're pregnant and naturally occurring separation that happens, we still need to manage the pressures and how the linea alba, which is the midline of our abdominals, how that tissue is managing the forces underneath it. And do we get a doming that happens? And sometimes that's okay, and sometimes that's not, depending on what you're doing and how you are, again, managing those pressures. So the importance then of what the pelvic floor can do is it can provide you a pressure management resource with your breathing. And so our respiratory diaphragm and our pelvic floor work in synchrony together, or they're meant to work in synchrony together. And one of the simplest things for us to be able to do is learn how to get them to work together again. Because a lot of the times we disrupt that synchrony, and it could be from stress, and we breathe really shallow when we're stressed out in our fight and flight, or we are pregnant and we don't have the space to breathe down. And then postpartum, we don't know how to bring that back into a more synchronized breathing pattern, and we're stuck in that inflation in inhalation state. And so that's kind of the easiest way for us to then learn how to exercise again, bringing in that pelvic floor, is breathing first and foremost, and getting that better. So once we know how to breathe properly, meaning we want to inhale down, we want our trunk to fill. More importantly, we want our ribs to fill 90%, and then we want our pelvis to fill the rest of the 10%. And what that allows us to be able to do is that allows our pelvic floor to lengthen. And that is a really important thing, especially for lifting, because it provides the rebound force that is necessary for our exhale to then lift and keep the pressure in. Well, not really in, because The pressure is going out, but it's going out our mouth.
Right, right. Instead of other places.
Exactly. It's going up and out versus down and out when we are lifting. And so that is extremely important for us to be able to do. Here's a really easy image for us to think about with this whole breathing aspect of breathing down on inhale and allowing that lengthening to happen, and then that rebound contraction to happen on our exhale, is if we were going to throw a ball or kick a ball, if you don't wind up for it, you could throw it, but it's not going to have a lot of oomph to it. If you then wind up for it, you can huck that ball so much farther or kick that ball so much farther because you have wound up for it. Mm-hmm. So that's the same aspect or the same theory behind the inhale to lengthen. We get this whole new length tension relationship behind the muscle of the pelvic floor, so that you can provide that support that is necessary to then withstand the pressures and loads that you're placing on the pelvic floor in the exercise or the lifting. And the other important piece of the pelvic floor with lifting is how it coordinates with the rest of the body. Because your pelvic floor, as awesome as it is, it's a pretty small muscle group. And so if you are lifting a substantial amount of weight, whether it be lifting for exercise or lifting in your daily life, I mean, if you're lifting a 40-pound child over and over and over again, that's a lot. And so having the ability of your pelvic floor to work with the rest of your core system, so not only your breathing, but correctly with your abdominals, correctly with your glutes, correcting with, certain other back musculature. And that is going to then allow you to have a much better support system and control with that lift.
Yep. And this is men and women, both.
And this is men and women. I mean, this is anyone who lifts, which is everyone.
Yeah, exactly. Anyone with a pelvic floor. This is important.
Exactly. So I mean, it's super, super important. And all of these things are going to be impacted by the mechanics of how we lift, the posture that we take, the alignment that we have, because the force factors within how our muscles work are going to be impacted on if they are overly shortened or overly lengthened in particular alignments. And that's also going to impact the force, the pressures within our trunk. If we are in a super celch position, or if we are super arched up and flaring our ribs forward, or if we tuck our butt under, all of those postures are going to put a disadvantage on our whole core system, which is going to make it even harder for us to control those pressures, which is going to make it harder for us to lift properly. Mm-hmm. And then eventually the pelvic floor is going to break.
Right. Because if you don't care for it in the right ways and you do the same things over and over again, expecting different results, and then all of a sudden, Houston, we have a problem.
Right. So that comes into play where some people, their pelvic floors are totally fine. They have strong pelvic floors. They can relax them and lengthen them. There's no tension, but they still leak, or they still have this pressure. And they wonder why. And they're like, why? But I have a strong pelvic floor. What is going on? Well, that's because the pressures above aren't being managed in a proper fashion, either because of the alignment that you're taking or because of how you are actually contracting your pelvic floor, or sorry, not the pelvic floor, but the abdominals. Mm-hmm. Maybe you're clenching through your abdominals, or you're oblique dominant and you're really contracting those side abdominals, and that's putting more pressure down into the pelvic floor. Or maybe you breathe opposite, and you actually breathe up on inhale and down on exhale. And that puts more pressure into the pelvic floor. So there's all of these other kind of mechanics and functions above the pelvic floor that could be impacting the pelvic floor when you are lifting or exercising that could then impact the role of the pelvic floor, and the pelvic floor can't withstand that additional load on it. Because again, that layering effect.
Right. Now, we were talking about hormones affecting this
Yes.
equation. So, are there cyclical considerations for bleeding bodies who go through a menstrual process every month? Are there different exercises or different focal considerations that should be taken into account as we proceed through our cycle? Because all too often we make the assumption that we are like men's bodies and our hormones are, held a little more constant, and we don't take into consideration that we are a 28 to 30 day, our hormones move in, X number of day patterns all the way through our month, which affects our energy, affects all kinds of things, how verbal we are, our planning functions, all of these kinds of things. I would assume it would also affect what we should and shouldn't be doing in terms of our pelvic floor and in respect to exercise.
Absolutely. So like I said before, I call estrogen our fluffing hormone because of its role in muscle function and tissue health. And so as our estrogen fluctuates, we're going to see a difference in how our muscles actually function, especially around the muscles that are more involved or more influenced by our hormones, thus the pelvic floor. Because our pelvic floor not only is muscle, but it is other tissues, and those other tissues need hydration. And as we change throughout our cycle, our hydration level in that area changes widely. And so we have to definitely take that into consideration. So when we are at our peak estrogen levels, around our ovulation, that is when it is best to do lifting and activities that are going to be more strenuous on our body, because our body is going to be able to handle it better. However, when we then go to where our estrogen is at its lowest, when we're bleeding, that is when we're leading up to our bleeding, about that week beforehand too, and a little bit afterwards, right? We want to do activities that are less strenuous on our body, especially on our pelvic floor. So we're not going to be doing a lot of loading. We're not going to be doing a lot of jumping. We're not going to be putting a lot of forces. We're not going to be doing a lot of running. Or some people might, but in terms of the cyclical nature and the hormones, it's best not to actually, when our estrogen levels are really low, because it's harder for our muscles to actually provide the support that is necessary, which is why actually we see more female athlete injury during certain times of the month, because estrogen isn't there to give us that support that's necessary in the fibers of our muscles and in our ligaments, and the other connective tissue. And so it's really important to think about, okay, so if I want to support my body and my pelvic floor and my pelvic health as much as possible, let me follow my cycle, and I'm going to do more loading and jumping and the excess stuff when my estrogen's at its peak, and then calm it down and do more things that are not as excessive on my body when I am bleeding and leading up to and a little bit afterwards, so that I don't injure myself and have problems within the pelvic floor. Because even if you don't have problems in the pelvic floor now, it doesn't mean that you won't in the future, because again of that accumulation effect.
Yeah. And I talk to women about this too. Like I lift and I used to run long distance and I was a competitive martial artist. So, as you're talking about this, I'm thinking to myself, oh yeah. So I remember trying to take a scheduled fight. I did it like twice and I was like, this is the dumbest thing I've ever done in my life. Because trying to keep up, and I was not quite to my bleed yet. One of them was like, I would say like maybe day 24 of my cycle. So close enough, but not quite there yet. And I felt like I was super winded and I was just struggling. I'm like, usually I can get through 3-minute rounds with no big deal, right? Not even bat an eye. And I was like sucking wind like it was my job. And just, I barely hung on
Mm-hmm.
through that fight. And I've had a couple that have been before day 7 of my cycle that have made me feel the same way, except I feel like I don't have any like punching power. I don't have any
Power.
strength
Yeah.
in
Yep.
my body. So on one end, I feel more winded. On the other end, I just feel straight up weak. But then close to ovulation, that's when I'm deadlifting like
Mm-hmm.
250 plus, and it's not hard. It's
Yes.
just there.
Yes.
And it makes me feel like a superhero. And then the hormones start changing again and we start going in another direction. So I think this is a really, really important thing for women to begin to recognize about their bodies, is that our hormones govern
Mm.
all of our functions, like from our work ability and our planning ability and our energy, because like a lot of us will have that nasty self-talk in our head about, oh, well, I should be able to do this. I just have to push through, like
Yep.
those types of narratives, because we're just expected to work like this
Right.
stuff isn't happening in the background.
Right.
And it leads, exactly like you said, to future problems, because you push through and push through and push through, not honoring, I can't tell you the number of women that I see in weightlifting forums that I belong to, because I'm north of 35. So my focus on weightlifting is more there at this point
Yeah.
than, being a competitive fighter anymore. I'm old. But because that focus has shifted, like there are so many women in these forums that are like, oh, I just need support today because I feel so gassed. And then I'll throw into the comments like, are you on your period right now? Yeah, I'm on day 3. You shouldn't be trying to
No.
lift like that on day 3.
Right.
You're probably
Yeah.
still bleeding.
Right. Yes. And it's a disservice.
Mm-hmm.
It's a societal message to us, but also it's not provided to persons who have hormones like us.
Mm-hmm.
That you can support yourself in different ways, and it's actually going to make your exercise routine, if you have a specific one, especially with lifting, better if you don't try to push through and
Mm-hmm.
you supplement with other forms of exercise during the times that your body just isn't up for the heavy stuff, the major lifting, or say the long distance running, or whatnot, or the HIIT style. It's, if you supplement and cross train to support the functions of your body based on your hormones, you're going to be less likely to injure yourself, but also you're going to be exposing the muscles in your body to different ways of using them, so that when you then need to apply them in a different way with, say, you're lifting, or running, or your HIIT, or the more intense exercise, you're actually going to be expanding your capability.
Mm-hmm.
It goes back to, well, you want to make sure that your muscles can lengthen,
Mm-hmm.
to provide that explosion behind it, to provide that big oomph,
Mm-hmm.
right? That if you're constantly building, but never doing the resting portion of it or the lengthening portioning of it, you're not going to be able to get that big power underneath it.
Mm-hmm.
So during the times where our body is going, I need that rest time, I need to slow down,
Mm-hmm.
it's almost permission for you to say, oh, okay, I'm going to shift my gears now so that I am lengthening and doing supportive exercises so that when I get back to my lifting.
And so I'm going to take that thought and I'm going to stick in one of the biggest things I hear from people when I make that suggestion, which is, well, but I still want to lose weight.
Oh.
Because that ends up being the focal point. Like for a lot of women, the reason that they're doing this is not to make sure that their body endurance for life is
Right.
there. They're not lifting so that
Right.
they can repetitively lift that 40-pound child. Like they are lifting because they want to get into a smaller size pants.
Right.
And there already is this misunderstanding that we have to do a ton of cardio in order to get into the pants, right? And instead of like, hey, muscle's hungry and it'll help you
Strength
get into the
training.
pants. Yeah. So we're fighting that a little bit. So if we were to exercise in this cyclical fashion, will we still see the results in terms of measurements in the scale?
That is such a loaded question.
Oh, I know it is. And I knew you'd have an answer for it too, because it is the number one complaint I get from people when I ask them to move with their cycle.
So this is for those who don't have underlying medical conditions. I have to put that out there because, of course, there are some people who there are underlying medical conditions like lipodemia or things that exercise isn't going to be enough. So if you are following the natural flow of your body, and for us, that is the natural ebb and flow of our hormones throughout our cycle, you are going to be stressing your body out a lot less. And it is shown that stress is a major driver in weight.
That is, yes. Sing it, sister. Keep going.
So if you are constantly stressing your body out by doing more than it is necessary, or not really necessary, but more than your body can handle in a particular part of your cycle, it is going to increase your cortisol, which sometimes is a good thing, but not always. The chronic increase in cortisol is not a good thing. And that is actually going to hinder weight loss.
Yep.
And it will also, because a lot of times that is when you are exercising in a way that is too much, it's also going to impact your sleep patterns.
Yes.
That's going to change your stress hormones. Yep. And that is also going to impact your weight. So it's a very good idea to follow the cyclical nature of your hormones, because just take yoga, for example, right? Yoga is not a power, unless you're doing power yoga, but even power yoga, it's not a weight lifting thing. It's not, yes, you're strengthening, but it's a very different strengthening than strength training. Yeah, people can still lose weight with it.
Yep.
So we really, by honoring what our body is offering up for us as a pattern and as a plan, we can see better results than if we try to disregard it.
Mm-hmm. And just push through.
Yeah.
Yep. Oh, that's excellent. Thank you so much, because that was an excellent explanation. But it's so true. Like, stress isn't just 100 unanswered emails in our
Right.
inbox. Like, it's it's our quality of sleep. It's things in our environment. It's pushing through
Right.
on those days where we're super tired and our body is screaming at us to rest, and we find 1,000 reasons why we quote unquote can't.
Right.
You know, sometimes life doesn't allow us to slow down and stop completely, but there are ways to life hack and
Mm-hmm.
give yourself and your nervous system your just chances to stop. And it could be as simple as a 20-minute cat nap in your car on your lunch break. It could be sitting outside on a park bench while you're having your coffee break and literally turning your brain off for 10 minutes. Like, there's so many ways that we can sneak a little bit of that stop
Mm-hmm.
into our lives. And because we don't, we have so many things that fall
Yeah.
into that stress category. And I think that's a beautiful summation.
And I'm gonna circle that back around to the pelvic floor, because this is something that a lot of people don't think about in terms of exercise in the pelvic floor. And a lot of people think I'm having pelvic floor issues, I'm leaking, I'm feeling pressure when I'm exercising, what have it. My pelvic floor must be weak. However, vast majority, it's actually because your pelvic floor is super tight. And especially in these past 2 years, we have seen an increase, a substantial increase in pelvic floor tension, not weakness, even after having a baby.
And now for a quick break and a word from our sponsor. If you haven't heard about Anchor by Spotify, it is the easiest way to make a podcast with everything you need in one place. Let me explain. Anchor has tools that allows you to record and edit your podcast right from your phone or computer. When hosting on Anchor, you can distribute your podcast on listening platforms like Spotify, Apple Podcast, and more. It's everything you need to make a podcast in one place. And best of all, Anchor is totally free. Download the Anchor app or go to Anchor FM to get started.
Tension, a lot of the times, comes from stress and overdoing it and pushing through. Yes, it comes from injury. Yes, it comes from alignment and some other things, but a lot of it is because of stress. And the connection between our emotions and our nervous system, our pelvic floor and our nervous system are intricately linked. Mm-hmm. And when our body feels like high alert, something's wrong, our pelvic floor is going to clench down.
Yeah.
And when we are in that chronic state, it's not going to let go. And so getting back to okay, we need a wind up. We need our pelvic floor to lengthen, to go,
Mm-hmm.
before it contracts. We need to then also look at, okay, what are my stress levels? Am I sleeping well? Am I wound up?
Yeah.
And maybe I need to address that first before I go into the exercises that are going to stress my body even more.
Yep.
Which again can be a good thing if it is ready.
Right. Yeah.
So just putting that out there too.
I think that's so important to address, because I've seen it with my clients over the course of the last couple of years. They're like, if I didn't have steaming, I probably would have gone on anxiety meds. Or if I hadn't had steaming, I would have gotten so depressed being locked in. And like the last few years have been incredibly stressful on people's
Mhm.
bodies. I'm rocking an additional 20 so pounds because of stress. Like, it didn't come on until my kids came home with laptops when the world shut down.
Oh yeah.
And I'm working on it now. But it was completely stress induced because literally nothing else changed about my diet, my exercise habits, like nothing. And
Mhm.
I mean, just stress. I put on like over 25 pounds, and it's so stubborn at my age to come off. It's very frustrating, but you know, I talk to my clients about that being chased by a saber-toothed tiger effect.
Yes.
And that, when you were talking about the clenching, I'm like, yep, that's exactly right in line with the analogy that I use with people, because, your body can't tell the difference between 100
No.
unanswered emails in your inbox and literally being chased by a saber-toothed tiger. It has the same response in your system. Your system prioritizes the resources to get you away from the tiger.
Yeah.
And, we don't always that. And sometimes people are so, and I've noticed this in the people that come in for acutonics, is sometimes we're so desensitized to the stress because we've been in such a chronic stress state for so long that we can't even see that we're stressed,
Yeah.
which is really like sad and
Mhm.
scary in some ways, because it really forces us to have that gut check moment where we take a step back and go, okay, what no longer serves me, what can I let go, and see how that feels in your body. Because if you feel a lightning effect, it means that you're doing too much, and we don't always take that pause, and that has that cascade effect on everything else. So we've talked about cycle considerations, and how that affects what we choose to do when we choose to do it.
Mhm.
Um, for women who are trying to conceive,
Yes.
because their focus is on fertility, and from a Chinese medicine standpoint, fertility comes from a place of abundance. From your perspective, if you're trying to conceive, can you still lift as normal?
So if you are lifting on a regular basis and you, this is kind of a roundabout answer, but there are several things to consider when you're trying to conceive and still lifting, quote, as normal. First, if your normal was not healthy to begin with,
Mm-hmm.
then it needs to change. And what I mean by lifting, you were doing it more than what your body could handle, and you are maybe underweight, you don't have the fat stores, you're not eating to replenish, then that is an issue, and that lifting as normal needs to change. However, if you have been lifting and you are appropriately replenishing your nutrients, you are lifting, the appropriate for what your body can handle, then your body's used to that, and it shouldn't. And your cycle shows
Yeah, that it's not affecting your
that
cycle.
it is not impacted by it. Right? You have clear signs of ovulation. You're not missing your periods. Right? You have your cycle.
Yeah. Yeah.
Essentially. Then lifting, quote, as normal is totally fine, because your body is healthy. It's saying, yeah, we're good with this. This is fine. If lifting is brand spanking new to you, you may need to seek a little bit more guidance around how to make sure that it doesn't impact your cycle because you accidentally do too much. Because even with regular new exercise, it can impact your cycle. So,
Mm-hmm.
um, you really want to make sure that you are staying regular and you are replenishing, if you're new to lifting and you want to continue. Again, these lifting, there's so many different spectrums to lifting. There's the low weight lifting to the heavy weight lifting. And there are women who are bodybuilders and have gotten pregnant. So it's not necessarily the lifting that is always the factor. It's the everything else around it that supports the lifting aspect too. In terms of, is the habit around lifting a healthy habit, or is it an unhealthy habit around lifting? And your cycle is really going to be the way for you to know if it is or not. Because if your cycle is irregular and you're not having clear signs, then that's going to show you that the lifting may be, or at least the habits around the lifting may need to be adjusted to support that. In terms of the physical impact of lifting when you're trying to conceive, for some women, it can be a good thing because you're strengthening. So for those who have PCOS or potentially endometriosis, the strength training aspect of the weightlifting can be really powerful.
Yep.
So, but again, with guidance, so that you know what signs to look for in your cycle, and okay, that was too much, or, oh, I can push it a little bit more, or, what, I am going to only weightlift when I'm ovulating and then wait in my luteal phase and do other supportive things in my luteal phase. So, it's not necessarily just the lifting that needs to be looked at with the trying to conceive.
Absolutely. Because I would extend that. Now, I said lifting because I specifically wanted to talk about like the pressure and the strength and the pelvic floor and all that, because I do have women who are power lifters who are, and that's kind of where their focus is. But I mean, you hit it spot on. And I was like, oh yes, like this is the stuff that I talk to my clients about, because your cycle is like an organic computer printout of how you lived your month. And it marks the beginning of your new month. And so, and we have some misconceptions around that. Like the period is not the end of the sentence. The period actually marks the beginning of the next cycle. But what it tells you is, did I burn it too hard the month prior? Did I not eat enough? Did I not sleep well enough? Did I not get the proper nutrients and those types of things? Did I not create enough balance in my life? Like I always joke, if my period comes early, I'm like, oh, well, I guess my body's telling me I'm a little more stressed than I thought I was. But it's really true. So any types of stress, exercise stress. This could be doing HIIT cardio, or it could be any type of exercise related stress in addition to life and et cetera, et cetera.
Right.
But, you have to come from a place of abundance to conceive, and having stress be, and particularly chronic stress, be a big factor in that equation. You will see other things. You were talking about ovulation. A lot of times when you're in a stress state like that, you will not have clear signs of your fertile window and ovulation. You won't even know. Sometimes people will be anovulatory because there are not enough resources to go around, and the body is prioritizing getting away from the tiger because of the stress response, because it goes uterus. I don't need the uterus unless I get away from the tiger. And so it can completely turn off effective communication between the hypothalamus, pituitary, and ovaries, like just gone, done. So that's really, really important when trying to conceive, because I have worked with some people who are, working very actively with their partner to have healthy conception. But then I find out that they are an aerobics instructor that also works out in between when they are working.
Yeah.
And it's, and then they have a really hard time to either get pregnant or know when they should be trying, because they don't have really clear fertile markers. Now we've had the baby. Okay. We've gotten you pregnant. You've had the baby. When can you get back to exercising after you've had the baby? And I know there's a lot of factors in there, and I'm asking you some questions that like are multidimensional here, but just kind of broad strokes.
Yeah, absolutely. So of course, everyone thinks 6 weeks is the time that, yeah, I can get back to exercise. But really, so in my view, to me, understanding what's happening in the pelvic floor starts in the preconception phase. And here's a side note before I get back to the postpartum piece, but it is actually really important to know what your pelvic floor ability is and connection is prior to getting pregnant, because you know what your baseline is. You know where you're starting from. And it's not to know to get back to, that phrase. It's okay, I know what has been. Now I know what my quote first normal was. Where am I now? So exercising after baby really can start almost immediately after. And I say that because to me, that involves breathing.
Yes. so going back to the beginning of the episode, so let's look at the importance of breathing. Sorry, continue.
Yes, exactly. So exercise after baby starts with very gentle things. It's going to be, okay, I'm going to just do some really soft, gentle neck movements, shoulder rolls. I'm going to do some breathing exercises on my side so I can start to get my ribs to soften back down. Can I connect to my pelvic floor when I'm breathing? What do I feel? Right? So that's the type of exercise that you can start immediately after having baby. If you feel like it, you don't have to.
I remember that winded feeling that you were talking about, where your ribs weren't coming back down. Like, I remember after I gave birth to my daughter, I felt like I needed a crane to get me out of bed, because I just really had underestimated just how much my amazing trunk was doing for me.
Right. Yeah.
But that breathing effect, it was hard. Like I felt constantly inflated. And I loved when you described it that way, because I didn't know what I didn't know, as so many people don't.
Right. And this is one reason why we do see more tension in the pelvic floor, is because when that diaphragm is lifted up and stuck up, your pelvic floor is going to go, oh, well, everything's up.
I'm just doing my job.
Right. And if the respiratory diaphragm can't go down, the pelvic floor is going to go, well, I can't go down either. Right. So doing really simple, gentle exercises like that to begin with is not only going to help with your healing process, because if you get your diaphragm to move more, you're going to help with that sump pump effect, which is going to help clear out the inflammation that is naturally occurring after having a baby. And it's going to help flush out the chemicals that are naturally occurring and the toxins and everything, just because we had a huge rush of hormones and chemicals to help with that process, right? And now we need to help the body get rid of that. And because of that sump pump effect, we want to be able to breathe to get the pelvic floor to lengthen and to naturally come back up without even needing to contract extra. And so you can start immediately after having a baby to exercise in that way. But you need to change your mindset about what exercise actually is. If exercise in your brain is just running or just lifting or just strength training, then no.
Mm-hmm. Yep.
You are not going to start those immediately after. And you're probably not going to start those even at your 6 weeks.
Yeah.
So what the 6 weeks is a disservice to us when your OB or your midwife says, okay, yep, check, you can exercise. They are not actually trained in assessing your muscular function. What they are assessing is your organs,
yeah,
and just your tissues, and seeing, okay, everything has healed. You're like, if you tore, that may look better. If you had a cesarean, okay, your scar is healing. But they're not assessing your muscular function. And you need your muscular function to exercise.
Or to do anything.
To do anything, yes, to do anything. But to especially do the extra of exercise. And you're probably thinking, but I need to exercise to get that muscle function. Yeah, you're right. But you need to do it in a mindful, very intentional, very progressive way after having a baby. You are not going to go right back to what you were doing prior to having a baby, because birth is one of the quickest and fastest changes in our physical being you will ever experience. And your pelvic floor and your abdominals are the most impacted muscle groups from that. And because the pelvic floor works with our abdominals and our whole core system to manage the pressures within our trunk, to then have all of those, the support, the sphincter, the stability, the sex, the sump pump, to have all of that function properly, if we don't gradually bring those functions back with restoring proper length to the pelvic floor, to the abdominals, what's going to happen is your body, your amazing body, is going to create habits and compensations to get you by, which is the amazing part about our body. Our body's going to go, well, I have to do this, so I'm going to figure out a way to do it. Unfortunately, even those habits and those new compensations are not going to serve you in the long run and could cause more problems in the long run. And so we need to then take a step back with our exercise mindset and the actual forms of exercise and say, okay, I need to make sure that my deepest layers are restored first. So my pelvic floor can lengthen and contract on demand, or at least when I'm thinking about it. I can contract my abdominals properly. I don't clench them. I can lengthen them and let them go. And I can uniformly contract them with the pelvic floor. I don't feel like my ribs are stuck up. I can keep good form. And all of these things you will be able to do with proper corrective exercises, so that then you are setting yourself up. You are creating the foundation to return to higher level exercise, like the weightlifting, like the running, like the HIIT exercises. And your body is going to say, yep, we got this, versus having to backtrack and go, oh, well, I have to stop this now because I'm having these issues, which is fine. I mean, stop and rehab. But it's a lot. It'll take less energy to start with the rehab and the rebuild prior to the really return to the function that you want.
Yep. And it's so important. It's like layers of an onion.
Right.
But instead of peeling them back, you're starting
Yeah.
from the inside and working out.
Exactly. Instead of having to peel from the outside and work down, which is what I have to do with all, with my patients, is we have to peel away to get to the core, and then we have to rebuild it back up. And that still sometimes happens with postpartum, is because were those old habits. Mm-hmm. But if we can start early on with the healing process, and then get that restoring naturally occurring, then we don't have to take away. But we also have to think about, again, that pressure system. And if our pressure system is still healing and still rebuilding, certain exercises have been shown to actually be more problematic if we reintroduce them too early than if we wait. And when I say wait, I'm talking at least 6 months after having a baby. And this is evidence-based. And the biggest one is running and weightlifting. It is when we are putting the excess load from below or the excess load from above. When our pressure system, the whole system from the pelvic floor up, cannot withstand those loads because it is still rebuilding and is still figuring things out. If we reintroduce those too soon, you actually increase your risk of prolapse, you increase your risk of incontinence, you increase your risk of injury. So we need to take a step back and go, okay, I want to return to these things. How can I do it in a safe way and in a way that is going to get me there with even more strength and stability and control?
That's excellent, because in a woman's life, we have 3 really big opportunities to hit the reset button on our health.
Yes.
And postpartum is one of them.
Totally one of them.
And so when you're talking about this really mindful way of re-strengthening, rebuilding, allowing the healing process to happen, like in our Western culture, we, think that we can go back to full functioning at 6 weeks, like you were saying. And the thing is like, in a lot of cultures, they really honor that 4th trimester. That's 3 months after you have a baby. 30 to 40 days at the beginning is spent in bed because your body needs time to heal.
Right.
You just built a little miracle with your body and delivered said miracle. And in some cases are also still nursing this miracle, and you are taking of your resources, which changes your healing. Right. And so you need to be super gentle with yourself and allow for space for that. And I could totally step onto a soapbox about all of the garbage in our Western culture, or at least in the United States, with lack of maternal leave, paid leave, all these things. Like, there's so many things I could complain about right now because we really have a broken system. But one of the areas of the system that is broken is allowing the space for mom to heal properly and creating the awareness around letting mom heal properly, and the fact that it is a gentle and gradual process. However, if you allow that space for that healing to take place in that critical reset window, then you're now looking at a powerhouse of a body that is going to serve you really, really well. So this dovetails beautifully with my next question, which is age considerations for weightlifting, because menopause is another one of those reset moments in a woman's life where you get to hit the reset button on your health and well-being. And, you'll see stories or pictures of 70 or 80-year-old women who are now like these totally cut bodybuilders and whatnot, although our culture seems to have this concept of as we age we become more fragile.
Mm.
And an Eastern perspective, it's actually about balance in all of that. So you can absolutely become a very strong weightlifting person, but as long as you're providing your body with the appropriate amounts of rest and healing in between each of your sessions. So after 40, your overall vitality really is, at least from the perspective I practice from, is really wound up in being mindful about places where you are working hard, or hopefully not overworking, because it's all, the name of the game is balance here, right? But that, where you're working hard, but then balancing that with enough
Right.
restoration.
Yeah, I mean, so it's especially for women, it's really important to do exercise that is weight bearing,
Mm-hmm.
especially when we start to go through menopause and we lose our estrogen and our hormones change, because we need to support our bone density and our cardiovascular health. And actually, strength training and weightlifting can help with those shifts. It can actually the help your body process those changes in the hormones. But like you said, you just have to do it in a mindful way. So still almost thinking about following a cyclical pattern to provide those respites between the weightlifting. But it's not, it's again, it's really, it's about bringing the intentionality behind the form of the exercise, in this case weightlifting, and progressing with what your body is allowing. So no one, especially after 40, is going to start off with an extremely heavy weight.
Right.
And you actually will probably injure yourself if you do that. But it is absolutely possible and can be really great on your body if you start off with what your body is capable of doing, even if that's just 10 pounds, and progressing and increasing. Because I mean, our bodies are flexible, and they are still, plastic and able to change regardless of our age. And I mean, I agree that we shouldn't just let ourselves stop just because we hit a certain age. It may be more challenging because yes, things are physically changing in our cellular, on our cellular level, but we can support that change. Mm-hmm. And by exercising is one way to do that. And there's evidence behind that. And so weightlifting, especially for females, can be a great way to improve our health as we age.
And we shouldn't be afraid of it.
Absolutely not. Because but like you said, as long as we balance it out properly, because we have to take in those considerations of the changes in our hormones and like I said earlier, our estrogen is really important for our muscle and our tissue function. And because in our menopause, those are lower, we do need to be aware that we have to take those breaks maybe a little bit more often than we did before to help our muscles rebuild, which is what is then going to provide that strength. Essentially, when we are weightlifting or when we are strength training, we are doing little micro injuries to our muscles.
Mm-hmm.
And that needs to then repair. And it just takes us a little bit longer to repair as we age. But if we are supporting that with our nutrients and our sleep and our other habits, then it's a great thing to do.
Mm-hmm. From a Chinese medicine standpoint, you've got that muscle tug on bone, which which is a kidney thing, and it helps to strengthen
Right.
your bones.
Exactly. Yeah. So that's why doing weight bearing and why doing like weight strength training is so important for our bone density. It's because of that tug and pull on our bones. That's actually how our bones form.
Mm-hmm.
Is from that tug and pull from the muscles on it. And that's why some of us have slightly different bone nubs and pulls. That's why people get Osgood-Slaughters in their knees, because of that pulling with our muscle, our bones, So it's important to understand that, you don't have to understand it all, but knowing that, if I do this, I'm also going to be supporting my bone health, which is going to keep me going longer and reduce my risk of fractures and other injuries as we age. And that's also going to help with our cardiovascular health. Because strength training is going to get your heart going too.
Right. It's so important.
So there's a lot of benefits to continue to weight train and not be afraid of it. As long as you're doing it, just like in postpartum, in a progressive way. If it's brand new to you, you want to do it in a progressive way and start where your body's at. And not do nothing, because that's not going to help you at all. But really being in tune and listening to where you are and then progressing from there is going to get you the results that you want. It's nothing to be afraid of.
And now for a quick break and a word from our sponsor. Moon Essence is excited to bring you a new resource, the Moon Essence app. Moon Essence is a one-of-a-kind resource providing women a holistic way to support their reproductive health and wellness. Feel in the driver's seat of your own health with evidence-based interventions proven to decrease symptoms experienced with your cycle each month, increase your fertility, and ease life transitions for women in every phase of life. Empowering women's bodies with education about their health journey is the heart of our work. Head over to the Apple App Store or Google Play and download this free educational resource today. I love that. I intend on lifting well into old age, and I just... maybe because of where I'm sitting in my life now, I'm finding myself thinking about these types of age-related considerations and how can I be preventative of issues later on that I've either watched my grandmother have or my mother have or whatnot. And, how can I be proactive now? Because there's, like you were talking about prevention at the beginning of the episode, like there's so many aspects of aging that we can really affect with what our lifestyle is like right now. And the way that I work with my clients, 40 is kind of that magic number where in men and women, where our chi and our vitality start to kind of change. From a Chinese medicine standpoint, women move in 7-year cycles and men move in 8-year cycles. So a lot of times they hit their hormone benchmarks a little bit later than we do. However, they hit all those same benchmarks where they have these changes in their energy level and their vitality and things like that. And so I think that it's really beautiful to look at strength training as a way of being able to manage the aging process because it's so important.
Well, yeah. And if thinking also on the cellular level, strength training, it done in a healthy way,
Right.
it's going to support your metabolic processes. It's going to support your natural detoxification process, and that is going to help with your cellular aging.
Mm-hmm.
So yeah, I mean, it's really important. And if you keep up with the proper ways of supporting your pelvic floor as we age, it's not going to then also be a problem to continue with weightlifting if you know that your whole core system is functioning properly for you. And then you're not going to have a problem later on. Or, oh, this isn't normal.
Yeah. Yeah.
I gotta kind of take a step back and figure out what is now different and what I need to work on to restore now this function again. Because yeah, sometimes with those changes, we do see some changes in our capability, and we then just have to they're just clues into, oh, okay, I know this isn't normal. I need to kind of stop and reassess and see, oh, okay, I did this differently, and so I need to adjust here. So it's definitely, it really is a great way to support all health.
I agree. I really do. And this is why I wanted to focus on strength training with you, because I've heard you talk about these things in a lot of different settings, and I really do. I believe it is so important, and I'm so grateful that you had the time to share all of this wisdom with me today. One of the other things that before I let you go, because I feel like we could talk about this for a very long time, is with people who have prolapse.
Yeah.
Because it is very common, particularly after having children. And even, we get a lot of hollow organs in there as we start to age, depending on how we've been caring for ourselves up until that point. Will lifting make prolapse worse?
Such a great question. So again, you have to look at the whole system. Okay, so a prolapse is when the connective tissue of the pelvic organs, either the bladder, the uterus, the cervix, and the vagina, or the colon, is no longer able to support those organs, either one of them or two of them or everything. And so they kind of sag, they droop into the cavities, so they're not really meant to be in. And that is, like you said, very common after having a baby, because especially after a vaginal delivery, and unfortunately that is an increased risk of that one over a cesarean. However, there is still risk just because of the pregnancy itself, but it stretches everything out. So what we have to look at is then not only the pelvic floor function of how it can support by lifting, but then everything else around it. And this, again, gets right back to the breathing. And not only is it, okay, my pelvic floor may be weak, and so I need to strengthen up my pelvic floor so I can support my organs and take up the slack that the connective tissue is not providing. Or it's, oh, I'm not lengthening, and so I'm not providing that time for those muscles, and they're just tired out. And so then when I add more load to them with weightlifting, I can't support, and because they're just too tired out. Or above, I'm not breathing properly, or not necessarily breathing properly. I'm not synchronizing my breathing in a physiological way, or I'm gripping through my abs and I'm putting extra pressure down into the pelvic floor. And because my pelvic floor goes, oh, I can't do this, as well as the ligaments are not able to support, then you're going to feel that pressure. So if you are able to address the synchronizing of the breathing with the pelvic floor, any tension within the pelvic floor, and allowing the pelvic floor to let go so that it can contract when is necessary, as well as coordinating the whole core system to manage the pressures within your trunk, you should be able to lift without an increase in a prolapse.
That's awesome.
So, but again, you have to do it within what your body is capable of doing and build up.
Yep.
You can't start off at the top because your body's just going to go, nope, can't do that. But you can absolutely build up and make sure that everything is working the way it's meant to and efficiently, and it should not increase your risk of prolapse.
Now, if you do have a slight prolapse, so let's go back to our gleeking when we giggle situation.
Yep.
So let's say there's a slight bladder prolapse that's present, and somebody wants to weight lift. Is there a way to tighten up all that suspension system that you were talking about so that you don't go to lift and then have things go downward and leak?
Right. Yeah. So technically you cannot strengthen a ligament or connective tissue. Like they don't, once they're stretched, unfortunately they're stretched. Yes, nutritionally, like as long as you are getting in your collagen and your zinc and, you know, you're building up that way structurally, that's a great way to support on that level. So working with someone on that, if you need more support with that, totally do it. In terms of the physical, mechanical functionality, absolutely. Again, what you need to make sure that you are capable of doing is lengthening out that pelvic floor first and foremost.
Yep.
And then contracting it with the rest of the core system. And when the core system for deep core muscles, our respiratory diaphragm, our pelvic floor, our transverse abdominis, and our multifidus muscles. Those are our 4 deep core muscles. Those are what are going to help you manage the pressures within your trunk. So if you are able to get those 4 muscles to work in synchrony together, which means your respiratory diaphragm contracts and lengthens down on inhale, which lengthens the pelvic floor on inhale, slightly lengthens the abdominals. You're not gripping through the abs, but you're not doing a big belly breath. You have a nice, elongated, aligned posture. Then when you exhale from bottom up. Your pelvic floor turns on first, right? It's going to stop anything from going down. Your abdominals then follow in a very uniform way. I like to say it's a midline way. So you kind of zip up from the midline. You're not pulling your belly button to your spine. You're not clenching your upper abs. It is very uniform, flat. It is a corset around, wrapping around. And again, you're keeping that really good alignment. It has been shown that if you literally just look forward, if you, in your squat, you can throw off the rest of your core system.
Yep.
So, so it's by doing that and putting all of that into play and mastering that with less complex movements, gradually progressing the complexity of the movement and the complexity of the load, including your diaphragm ability, which I add in breathing exercises for that with loading your breathing.
Yep.
You can then manage that downward pressure with the lifting, even if you already have a prolapse.
That's awesome. Because I get that question a lot. And I think that's awesome. So in sum, you need to learn how to breathe properly and go see a pelvic PT.
Yes. I mean, a lot of people think that pelvic PT is literally Kegels or, okay, I just need to do this. And if if you go see a good pelvic PT, just like anything out there, there are ones that are awesome, and then there are ones that are not so awesome. I'm not going to say they're bad, but they're not so awesome.
Yeah.
And the ones that are really, truly going to serve you the best are going to look at your whole entire body, not just your pelvic floor. Because even though your pelvic floor is your keystone, we need to look at the entire bridge.
Right. Because it's interconnected. And honestly, that's how I practice as well, because your emotional, physical, and spiritual body are interconnected. Right. And I love the fact that even as an allopathic trained practitioner, you're also looking at the body that way. And we need more practitioners looking at the body that way in this holistic sense.
Absolutely.
Awesome. Well, like I said, could talk to you about this all day because I think this is fascinating. And this is something that we just don't talk enough about. We really don't. And so I'm hoping that this episode helps to raise some awareness of how darn important your pelvic floor is, when you should be seeking out some help, the fact that you probably haven't done it nearly enough. And as we go through life stages and changes, that things start to shift. And even if you haven't had issues for a while, or you've been powerlifting and you haven't had any issues and you think, oh no, I'm good. And then like 2 years down the road, you're like, oh dear, why didn't I address that? That, being able to work with a practitioner like Dr. Bailey or other pelvic PTs, if Dr. Bailey isn't in your area, that pelvic PT is really, really critically important to our overall health and well-being. And we need to raise the level of awareness of that interconnectedness, as well as the level of importance of this part of our body and the functions that it governs, supports, and regulates in our body.
Absolutely. Well said.
So, okay. So if people were looking for you, because I know you do some telework as well. So if people are looking for you, how would they find you?
The easiest would be to go to my website, expectingpelvichealth.com, or you can follow me on Instagram, again, Expecting Pelvic Health. Those would be the two places to find me the easiest on.
Wonderful. And I will include all of Dr. Bailey's contact information in the show notes. Any final thoughts before we end?
Oh man, there's so many, but I would say that if you are at all curious or just want to learn more about your own body, but you don't feel comfortable going and see a practitioner, or there's no one in your area, you can do your own assessment. You can check out your own body. And if you want to do that, I do have a free guide to do that. So I'll get the link to Adrienne so she can put that in the show notes. And so you can really be the knowledge bearer about your body, because I always say, I don't know the best about your body. I may know what is going to help you, but I'm just your guide. And so you really need to know what's up with your body. And this is a great first step for that, to do your own self-assessment. So if you're ever at all curious about that, it's a good place to start.
Awesome. And I will definitely include that in the show notes, because I think it is critically important for that level of self-awareness for a whole bunch of reasons. But thank you so much, Dr. Bailey, for taking the time out to talk with me today, to share your immense and incredible wisdom with all of our listeners. And we will have to do this again sometime, my friend.
Absolutely. Thanks for having me.
Thank you. This podcast is made possible by listeners like you. If you like what you hear, please consider making a contribution to the Reproductive Rebel podcast. Your support, in any amount, helps us continue to inspire current and future generations. Show your love for this content in the listeners support section below. And thank you from the bottom of our hearts. Thank you for joining me for another episode of Reproductive Rebel. Reproductive Rebel is recorded by certified peri-steam hydrotherapist, herbalist, sound healer, and Chinese nutritional therapist Adrienne Irizarry of Moon Essence LLC. If you are interested in setting up an appointment with Adrienne for one-on-one support, ordering from our store, or checking out our course offerings, visit our website at moonessence.life. Be sure to subscribe to our newsletter to get insider information on upcoming events and offerings. Join the conversation. Like us and follow Moon Essence Me on Instagram, Facebook, Twitter, or LinkedIn. Your voices make this program possible. Thank you all for your continued support.